Hello everyone, I am Dr. Sabha Rupani, a general surgery resident, and these are my badass lovely co-PGs, Dr. Shambhavi, Dr. Riya, Dr. Sumati, Dr. Pujita and Dr. Deekshika. Today we are here to talk about general surgery as a branch for females. So let's start with why general surgery.
Okay, I took general surgery because both my parents come from a medical background, both of them are doctors, and I can never think of any other profession except for medical because I've seen their lives, and my brother is an engineer, so I can contrast and see both of their lives, and I realized that medicine is what I would choose. Coming to general surgery, from the very beginning I knew that I'm a very tactile person, like very hands-on tactile person. So I know I can't just read books and just look at the investigations and write medicines, which is amazing. Obviously, that is amazing and it needs a lot of expertise. But I think surgery has best of both worlds, and it's more according to my temperament. So that's why.
Yeah. I decided on general surgery only in internship after doing surgery posting and experiencing what it feels like to be in an operation theatre and just the thrill of the operation. I knew I couldn't do anything else.
I think
not be an OT.
Yeah, I think this feeling with everybody who's taken up general surgery is that it's just a surreal feeling to be in the operation theatre there with the lights and the OT table operating. So
And blood on your hands.
And blood on your hands. And the blood part. Anything else you want to add, Dr. Sumati?
The sparkle in your eyes when you talk about your branch, whatever you want to do. If you don't have that, that's not the branch for you.
Yeah, I think yes. So for me also, from the day I entered MBBS, I knew that I want to be a surgeon, and here we are in general surgery today. What about you, Dr. Pujita?
My first encounter with the surgeon was when I was 17 years old, and he inspired me a lot. His name is Dr. A.G.K. Gokhale. He's Asia's #1 cardiothoracic surgeon. The way he came in the morning, wishing every patient in the wards and returning back with the same josh or whatever you call it, the energy, inspired me a lot. Not just because he was a surgeon, also because as a human being, he inspired me a lot within the span of 5 or 6 days of me staying in the hospital. From that day, I thought I want to be a doctor, not as a surgeon. I didn't figure out. But during the whole course of MBBS, I figured out, yes, I want to be a surgeon and nothing but a surgeon. So that's how I ended up.
Nice. I think that was a very inspiring story. Dr. Deekshika?
I, as such, don't have any inspiring story, but I have always seen all these OTT platform shows.
Yeah, like Grey's Anatomy. I think we have all been there.
And that just used to just give me that adrenaline rush. And
Exactly.
just by
Adrenaline
looking,
rush.
just by looking, I used to get the adrenaline. I used to imagine myself, me doing sometime saving somebody. And I joined UG, and from there only I knew I just wanted surgery, and that is it. And nothing else I would be fitting into. The moment from final year I started going into OT, and just wearing that mask, wearing the cap and everything, the feeling of entering and people calling you doctor, even just wearing the gown for the first time was gave me so much adrenaline rush.
Yeah.
I knew I have to be there.
And that is common among all of us, is that we knew from day one that we want to be a surgeon. It's a very common thing. The surgeon knows from before that.
You might deviate a bit, but in the end you'll come back to
Yes.
that thing.
Yeah. It's easy for a surgeon to figure out what he wants. Yeah. So adrenaline rush is what every surgeon would feel at least once.
So I think we all have different stories. Few got inspired by their family, few got inspired by some good doctors, and few have personal stories of their own. But at the end, one thing that we all have in common is that our heart was in surgery. We all wanted
Yes.
that, and
Always.
if your heart is there, then just go for it, is what we would say. Like I think whenever we go and speak about this to people and ask them and go and tell people that we want to take up general surgery, a lot of people have this opinion that just go for obs and gynae because it will give you both the feel of surgery as well as medicine. We've all been there, but we finally chose surgery and not obs and gynae. Not because obs and gynae is a bad branch, it is a very beautiful branch provided you like it and your heart is into it.
And it needs a lot of dedication for anyone.
Yeah. So why not obs and gynae? We'll try to answer it for you all.
Okay, so physiology is a very, very interesting branch, and we do have perks as females in OBG. We can't deny that because there are biases of patient and the patient party. But for me personally, I didn't want to be restricted to just the female reproductive system and just females as patients. I wanted to explore the entire human anatomy. So,
Regardless of gender.
regarding gender, that's why I took general surgery
Yeah, I
instead of OBG. That
Yeah.
was the only reason.
Yeah.
Okay.
Yeah, Dr. Ria.
Coming to Dr. Ria.
So there was a phase in my life where I liked OBG and I thought of taking it up also. But I think every surgeon I met or every doctor I met for guidance told me that I should take up OBG because I was a woman and because it would be more compatible for my future lifestyle. Because somehow it's easier or better understood by society that I'll be leaving something important at home to go deliver a baby, which is okay. But if I'm going to open up an abdomen, it's not acceptable. So
Maybe it's ironical, but yeah, that is the reality. That is how it is there in
Yeah.
people's mind.
But do you think it's now changing? The trend is changing. More females are taking up surgery, and even people are also coming up to female surgeons to discuss their problems. So it's good.
Yeah, I think we are all evolving. As of now, we have female co-PGs, like our own friends who are doing orthopedics in our own hospital.
Yeah,
So
exactly.
I think we are evolving and it's going towards a better side. Especially for me, when a lot of people told me take up obs and gynae, I somehow made up my mind that yes, I would take up obs and gynae, leave obs, go into gynac surgeries, robotics and all of it. But thankfully at the very end I understood, if I want surgery, then why to take this long path and not directly take up MS general surgery? Just because everybody else was telling me to take up obs and gynae, I tried to convince myself too, but finally I understood that no, I will be taking up general surgery. So if you know you want to be a surgeon, I think you should go for it. And coming to work-life balance, when they say, like, I don't know why they feel like obs and gynae is not a hectic branch. You have to get up. Yeah, like you might postpone an elective case. If you have a case of appendicitis, you can say yes, keep this to 7 p.m. But if a lady is going into labor, you cannot postpone it. So in the middle of the night, 3 o'clock, you have to get up, go and deliver the kid. So I don't think it's easy. So when they speak about female and obs and gynae, I don't know why it is put across that way, but it is not easy and very comfortable.
And also it always seen like that
Yeah.
females are going to female-oriented patients, the male mostly handling the surgery
Yeah.
side of
Side.
this.
But it's
like
changing
We have
now.
just seen it like that. It was never divided and discriminated. It was just what we have seen, we made a culture.
And
No, but I'll tell you what, going into our OPD,
Hmm.
I've seen a difference how doctors treat male patients and female patients. Surgeons also, like there is a difference. And you'll understand. There's subtle differences and you'll understand that. So I think the women population needs more female surgeons than male at times.
Yeah, I
like,
think yes.
then yes, that's like
things, the
bias
history
is
and everything that
in the
they tell
society.
us and what
And,
we can
I
understand
think-
being women is more important.
Yeah, I think
And
it makes sense.
one doctor whom I spoke to asked me a question like, you will be married by third year of your PG post graduation, and by at least SR-ship or you will become pregnant. Do you imagine yourself standing for that long hours and doing a surgery? And why is it not a gynac becoming pregnant and she's still delivering babies,
Yeah.
doing C-sections, going for OTs? And there are a lot of people I have seen who are doing orthopedics OTs, even they're like 6 months or 7 months old.
pregnant.
No,
pregnant. Yeah, I think
even in
medicine, exactly.
When my mom was pregnant with me, she was in the OPD till 10 a.m. and I was born at like 12 or 1 o'clock in the afternoon.
For
So,
this,
very-
for this thing, my mom also inspired me a lot. She was carrying me 8th month or 9th month when she was studying her law, third year exams. She was attending. She could do it, so she passed in first attempt and first grade. When she could do at that age, second issue, I am 35 years old. Why can't I?
Yeah,
do
why
it
can't
also?
this?
it depends on the person.
Hmm.
Like we don't, not everyone has to prove themselves.
Yeah.
If they want a maternity leave,
Yeah,
way
they
before-
can.
Yeah, you can.
It just depends on the person, what they prefer,
Yeah.
what they want, how
Exactly.
comfortable they are.
I think it's more of a personal choice. Yes, and now that we've spoken about family and marriage and pregnancy, coming to a work-life balance, I think it's a very personal choice. Even by taking general surgery, you can have work-life balance if you want to by taking a super specialty branch, which is more elective than emergency.
Yes.
Or if you want the thrill, you can go for neurosurgery, trauma, and all of it. So it is a very, very personal choice. Having said that, being successful in anything, like she said, law, or being a CEO of a company, being an entrepreneur, or anything good, you need to dedicate yourself with equal amount of hard work. So there is nothing different being a surgeon. You go into any medical field or anything outside medical as well. If you want to be good, then you have to put in that much of effort.
Even if a woman is sitting at home when she's pregnant, you think
Yeah.
she's resting.
That is also yeah, and I think if you really want, you can take a maternity leave. There is nothing harm. Maybe you will be like a year of yours will go away.
Yeah, that's not an end of the world.
Yeah.
Like you have a baby, you stop everything. No, that's not.
Like to travel for like
Yeah,
6 months.
exactly.
It's a very personal choice.
Very personal choice. And there are people who have operated till the last day they got into labor and then finally went into labor. So it's a very, very personal choice, and I think we can take that call for ourselves. And now that we've spoken about it, one more very important question that even we had and a lot of juniors keep asking us are periods and taking up general surgery, especially in residency days, and how do we cope up with that? So
Especially for the long standing hours.
yeah. Like I had very severe dysmenorrhea and even I had this question, but then I think eventually you somehow managed. Anybody who would want to talk about this?
I think if it's bad enough for you, obviously we take medications and we take our own precautions and everything. But if you're in the middle of surgery and you don't have any other option, it depends on who your co-PGs are. If they're
Yeah,
being
cooperative
helpful,
enough.
yeah. And it's never like you cannot, like if you can't take it anymore, it's not like you can't get out of it.
Yeah.
You can. It's better to take care of yourself, and I think that will help the patient more than standing over there
Yeah,
in pain
exactly.
and not being able to do anything to help.
Just to prove yourself.
Just
Just
Yeah,
to
That's
prove
something
yourself.
really-
That if you say it out that I'm on my periods and then people will think of it as an excuse or something, then that's not true. You are a woman, you
It's
have a
natural.
different life what men have.
Yeah.
So you should embrace it rather than
Taking it as something else.
something else.
Yeah.
Taking it against you, make it, like embrace it. That is all.
And I think few people have very easy-going periods, but for few people who have the dysmenorrhea, like even after taking pills, I am on bed for 2 days. But then we are all medical, so at the end of the day, if you are not able to, just talk to your co-PGs and your consultant, and it is okay. It is not something which is a deciding factor to whether to take up the branch or not, is what I feel. So now that we've spoken about all of this, let's also speak about male and female discrimination at workplace. So do we feel discriminated?
Okay.
Yeah.
Yeah.
We do.
We do.
Dr. Sumati, I think would answer for us.
Okay, so is there a discrimination in general surgery by your seniors? Yes. Your co-PGs? Yes. By sisters?
Yes.
Yes. By your patients? 100% yes. But then, it's almost everywhere. No?
Yeah.
Yeah, and I think we have just started and it is just our residency, but once you prove yourself, because you know who you are, and when the world knows who you are, then there would be no discrimination,
Yeah,
is
when
what I can
you
assure
walk
you.
in an OPD very confidently, when you walk in that ward very confidently, your chin up, nobody is going to question you whether, like, you have to just walk confidently that you can do this.
Yeah.
when you come out of the OT and that, you know, attendants are waiting for you, like, they do not say if it's a female surgery
Yeah,
or
or
a
a
patient.
male.
They just care about the
What
patient
do they
every
think?
time.
Exactly. When a patient enters the OPD, there is a mental block that the female must be the assistant
Yeah.
or the junior. Even if they are considering you as a surgeon, doctor,
Yeah.
like, she must be junior doctor. There is a bias. You
A
can't.
little bit, yes, at least in India it is.
Yeah.
But I think
But
it's
then,
changing.
when they talk to you,
Yeah.
when they discuss about their
Yeah.
problems and you're listening to them, you're
Then-
giving them advice.
Then they don't want to talk to the male surgeon.
That's very
Then your work matters, then your skills matter.
Exactly.
How you're treating the patient, like how you're
Yeah.
satisfying.
Yeah,
The
and you know,
patient's
like they say, the qualities of a surgeon, you know, you need to have lady's finger, you need to have eagle's eye, a lion's heart, and Solomon's judgment, they say. And we have it all. So when you're good at it, I think,
Yeah, we're literally born with it.
yeah, we're literally born with it. Yeah, exactly. So yeah, I think if any of you have a doubt of whether to take up surgery or not just because of the gender, I think you should not give it a second thought. And later on, you can take call on which super specialty to choose and how do you want your life to be ahead. But changing your branch just because of that particular thing is something I wouldn't recommend. So yeah, we'll all be very.
That's worse to not be satisfied with the branch that you
Yes.
took, and that will more affect your family life, your personal
Yeah, I
life,
think this is a very, very
than-
important point. Yeah.
than actually
Yeah,
your work.
yeah. So yeah, I think
No, one more point I'd like to add in the end would be if you're joining general surgery, I mean all the females, I'm talking about all the females, if you're joining general surgery, be a good co-PG to your other female surgeons.
yeah,
That's
best.
That's what we found.
Yeah, like
Yeah.
we are
And
so
we are
blessed,
so
I tell you. We are 8 of us, and I never imagined I would have this amazing co-PGs, you know. Like, there's just this girl power that we have in our batch.
So you have to,
Yeah,
at the
we're
end, you have-
always there for each other, which is very rare. But like she's saying, please be that female co-PG to your co-PGs, you know. Yeah. So yeah, I think we're all very excited to have you on the other side. Wishing you all the very best. Please take up general surgery if you want. And if you have any more questions,
If any questions left unanswered, please put them in comment box.
yeah, we'll be happy to answer you. And so yeah, at the end we'll conclude by saying, Scalpel doesn't know your gender.
All the best.
Bye.